episode, we continue our conversation with RUMC's optometrist, Dr. Joseph Muscente. Last episode, we discussed traumas and emergencies that can affect our eyes. In this episode, we'll discuss glaucoma and the importance of having your eyes checked regularly to detect any issues early on. Glaucoma is a very common eye disease affecting more than 70 million people worldwide, and it's the leading cause of blindness, accounting for over 12% of blindness around the world. According to the Glaucoma Research Foundation, as much as 40% of vision can be lost without a person noticing. Please tell us more about how glaucoma can affect the eye.
So glaucoma, like you mentioned, is an incredibly popular eye disease, unfortunately. So basically, glaucoma is an eye disease where the eye produces too much fluid inside the eye, and it causes damage to the back of the eye. So the pressure in the eye goes up, and it causes damage to the back of the eye, the optic nerve specifically. And that causes vision loss. And that's the most common type of glaucoma. You also get glaucoma, we just did trauma, you can also get glaucoma from traumas as well, which is the reason why you need to see your doctors, especially with eye trauma, to make sure that this isn't happening as well.
And how can someone find out if they have glaucoma? Can you walk us through a glaucoma diagnosis?
Yeah, so a regular eye exam, part of that eye exam is usually checking for glaucoma. It literally takes a minute, maybe even less, to do a glaucoma test. You put a drop of anesthetic in a person's eye, you say blink, 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 and then you check their pressure with, it's called a tonometer. It looks like a little probe, and it's a pretty blue light that kind of gets close to the front of the eye, touches it, and it measures the amount of pressure inside your eye. Exactly like a tire gauge. When you check your pressures in your tire, same exact thing. The whole process takes a minute at best. But even though it takes a minute, it's so important. So that's really how it happens. And every eye exam should include a glaucoma test.
And someone needs to be dilated for that test.
Not necessarily to check the pressure.
Okay.
You don't need to dilate the pupil to check the pressure, but you do need to dilate the pupil to take a look at the optic nerve, which is the other big piece of the puzzle when you're talking about glaucoma or potential diagnosis for glaucoma, and visual fields and other things that we do to kind of hone in on the, yes, this person has glaucoma.
Are cases of glaucoma increasing?
With diabetes, I would expect that cases of glaucoma are increasing. It's more common in people over 55 years old, unfortunately, which I am one of now. It's more common in African Americans, Hispanics, and Asians. It's more common in people with a family history of glaucoma, mom or dad or brothers or sisters. They should certainly have their eyes checked at least once a year. It's also more common in people who have had trauma, like we said, that kind of thing. So it's important to get it checked. It's such an easy thing to check. I'm not sure why people don't do it like they should.
You talked about juvenile diabetes being on the rise. Is this a condition that you're starting to see in the youth as well now?
We're not really seeing much glaucoma in the youth. Again, I don't really see pediatric patients very often, so I might be misspeaking, but I typically don't see many glaucomas in pediatric patients. There are conditions that can cause glaucomas in the pediatric realm, but they're not very common, fortunately.
So there's different kinds of glaucoma?
Yeah, the two big kinds of glaucoma are open angle and closed angle. Open angle is by far the more common one. That's the one where your eye produces too much fluid and the pressure goes up, kind of like overfilling a balloon, and it causes damage to the back of the eye. The other type of glaucoma called narrow angle glaucoma, let me backtrack. The angle is the part of the eye that's the pipeline of the fluid out. So it's like the sink of the eye. So if you have an open angle, the fluid drains more easily out, just like a flood in your house. If you have a very small and narrow angle, it's more difficult for the fluid to get out. So open angle, much more common. Closed or narrow angle is much more uncommon, although it does happen. The eye is producing enough fluid or the right amount, it just can't get out because the escape way is not open enough for it to get out. So either one of those things, open angle or closed angle, would give you the high eye pressure, which would pick up on a routine, ordinary eye exam.
So we talked earlier about the lack of people keeping up with their eye health. So what are some of the symptoms of glaucoma that someone might, maybe I need to go for an exam?
So the symptoms of glaucoma, unless the pressure is really high, really don't exist. They call it the silent thief of sight because it really doesn't cause any vision problems until it's advanced.
You don't feel it?
You don't feel it. It doesn't make your eyes hurt or burn or tear. You don't really notice anything. And like I mentioned in the previous podcast, I have glaucoma. And I was shocked when my doctor told me that I had glaucoma. Of course, I didn't believe him, so I wanted to see all the evidence. But he was right. I had glaucoma, and I had absolutely no symptoms whatsoever. So, you know, that in itself was kind of like lesson learned. You know, an ounce of prevention is really what it's all about.
So for someone like yourself who's diagnosed with glaucoma, how do you manage it?
For the most part, we can manage it with eye drops. Eye drops kind of lower the pressure to an area that's more normal for the eye, and that prevents or stops the progression of the disease. Unfortunately, glaucoma is not curable, but it is very preventable in most cases. The new thing now in glaucoma is they're doing surgeries with something called MIGS, M-I-G-S, and it's what it does is they're actually physically going in with a little instrument and opening up that drainage system while they do cataract surgery. So if a person has cataracts, they can go in, take care of the cataract, and put that little device in there that opens up the channels for the fluid to drain, and the pressure goes down. So that's kind of the new thing. Now the big quandary, I guess, for this is, should we be doing that first before we start eye drops? Because sometimes patients have to take 1, 2, 3 eye drops, which I take one and it's a pain, you know, to remember it. You know, just about twice a week, I get in bed, I'm all comfortable. Oh, I forgot to put my eye drops in. Got to get out of bed, put my eye drops in. So it's a pain to take one drop. I can imagine taking 3 drops at all different times of the day. You know, how cumbersome that can be as you move throughout your day. So the surgical technique has kind of been really an amazing new thing. We're not sure if it is best. Research is out there right now as we speak. If it's better to do the surgery before the drops or the drops before the surgery, the cart before the horse or the horse before the cart, kind of a thing. But I know we're doing it. We're starting to do it at RUMC as well. So it's definitely something that's starting to really come over the mountain in glaucoma care. And most of the glaucoma specialists have been doing it for a little bit, and they're gung-ho with how good it really works.
Is it a cure, or is it just...
It's not a cure. Remember, glaucoma is not curable.
Yeah.
At least as of this day, it's not. But it definitely is a way to further manage someone's eye pressure by someone who's non-compliant or someone who... A lot of elderly people have glaucoma, and they can't squeeze the bottle to get the eye drops in. So in that case, this would be perfect for them.
You often see the both together, the cataracts and glaucoma.
We do. So remember, glaucoma happens in age 55 or over most of the time. So that's kind of the time when cataracts start to happen. So very often we see the cataract, and there's a secondary problem with glaucoma. We can do 2 things at once, or I can. An ophthalmologist would do 2 things at once and make it better.
And is glaucoma a leading cause of blindness?
Absolutely. And I think that's really because people don't know they have it. I really am a believer in that, you know, get checked. It just doesn't make sense not to.
Right. I mean, I think to me, the reason I asked that about the blindness is because as we're talking here, even it's almost like, I'm not belittling anything that we're saying, but it's almost like, oh, well, you know, we can find it. All you got to do is take drops. Or it's almost like belittling the seriousness of diagnosis of glaucoma.
One of the things that is so unfortunate with glaucoma is, you know, you break your ankle, you get a cast, and then you get full function back. Once glaucoma takes away your vision, you can't get it back. So once you lose vision, you can't get it back. So you want to preserve everything that you have. That's the best way to kind of be able to go about living a functional life, is by preserving what you have and, you know, not making it get to a point where it's out of control and you've already lost significant amount of vision, because, like I said, we can't get it back.
Yeah. It's progressive, like it starts to happen in one area and then...
Yeah, typically, you know, if you think about it, you're looking at a beautiful panoramic picture, okay? So typically glaucoma will start way out in the peripheral vision. So think about the 4 corners of the picture being gone first. And you might not even notice it because it's small and it's way out here. And then the top and the bottom start to go, and then it just starts to close in. So periphery goes first, and it starts to close in until it closes in on your central vision. So that's pretty frightening, and it's pretty scary. And
it takes a long time to do it.
It does. It takes a long time, and it's slow, and it's insidious. So people don't know what's happening, you know. So it's really scary.
Regular
checkups are absolutely the best way to prevent it from happening.
If you have a diagnosis of glaucoma and say your right eye, will it migrate to the left eye?
Typically, glaucoma is a bilateral disease, which means it happens in both sides. It can be bilateral but asymmetric. So one eye could be a little bit more advanced than the other eye. That's for sure. In my case, my right eye is more advanced than my left eye. But, there are some reasons why you would have it in one eye and not the other, maybe trauma to one eye and not the other eye. That's a perfect example. But typically it's bilateral, both sides, but asymmetric, one eye being more advanced than the other.
And aside from the drops, there's no other medication?
So the drops are typical, what most people are on if they have glaucoma, myself included. The MIGS, which are minimally invasive glaucoma surgery, I forgot, I didn't tell you what that meant, is a new thing on the horizon that people we're seeing as working pretty well. Also, laser can sometimes be used to kind of open up those drainage canals that are backed up. So drops, laser, and MIGS are the three things that are pretty much commonplace in glaucoma treatment. If you're getting great results on an eye drop, and you're doing well, then they'll probably just use an eye drop. But it just depends on the patient, really, and how advanced it is.
So if a patient is diagnosed with glaucoma, should they be going more than once a year?
Typically, we see our controlled glaucoma patients every 3 or 4 months, just to check their pressure, take a good look behind the eye, to check their visual fields. Visual fields are, it's a computer test, kind of like playing a big video game. And what it does is it tells us how you see all around different areas of your eye. And that's important in glaucoma because remember we said peripheral vision goes first, and this machine will pick that up even better than a trained eye can. I mean, I can't see what my patients are seeing, but I can see things on the optic nerve that may suggest glaucoma or that pressure might be high. But the visual field can also confirm a lot of things as well. There's also a test called an OCT, which is ocular computerized tomography, which is the best way to describe it, I think, would be to say it's kind of like taking ultrasound to the back of the eye. It can actually measure how thick parts of the retina are. And we know which parts of the retina are affected most by glaucoma. So it can actually take your measurement in microns about how thick the retina areas are. So if I see on the OCT that area of the retina is getting thinner and thinner and thinner, that means cells are dying in the retina and it's getting thinner and thinner. So that's another red flag for me to say, hey, maybe this pressure is not low enough for this patient, or this person might need a MIGS procedure, or this person might need laser. So every treatment plan has to be tailored to the patient, but you have to put all the pieces of the puzzle together to kind of say, yes, this person has glaucoma.
And one of the things, you're doing all these tests at RUMC, right?
That's correct.
Okay. So one of the things that we do at RUMC a lot is we do the health fairs out in the community, and Dr. Joe is at a lot of these health fairs doing glaucoma screenings. So it's as simple as not having to even come to the hospital in some cases. So how do you do the screening at a health fair as opposed to in the lab? I'm assuming it's the same thing.
Yeah, so at a healthcare screening, we obviously use portable equipment. So I have a tonometer, which is that little plunger that we use to touch the eye and measure the pressure like the tire gauge. We have portable ones as well. We use them at health fairs. We use them at patients who are in a wheelchair, perhaps, that can't get out of the chair to get on the chair to have this done. So it's the same procedure. We anesthetize the front of the eye and we just touch the front of the eye and it comes up with an automatic reading. Screenings are great. They save a lot of eyesight. They save people a lot of grief by not knowing they have certain diseases. So very often if I see a patient, and I have seen lots of patients whose pressure is a little bit suspicious, here's my card. Come to my office or go to see your eye doctor, because I think when's your last eye exam? 10 years ago. Well, go check just to make sure. And that's what a screening is all about, to kind of just try to find ways we can help people, in our case, preserve their vision.
Are there certain lifestyle changes that glaucoma patients should make or things they should avoid?
Well, interestingly enough, I just read an article, and we talked about this before, is that standing on your head is really bad for glaucoma. Fortunately, I'm not a big headstander.
Me and myself is
that's one thing. And again, just a healthy lifestyle is probably the best thing you can do for glaucoma. Glaucoma is not only about just eye pressure, but it's about, the health of the blood vessels that feed the optic nerve. So we talk about diabetes affecting the blood vessels. We talk about high blood pressure affecting blood vessels. Those are the same blood vessels that affect your heart, that feed the eye. So if you're having a cardiac problem, so very often you have eye issues like glaucoma for the same reason. The blood vessels aren't doing their job. They're not getting blood to where it needs to be. So overall general health is the best way to go, I would think, for
So
glaucoma as well.
is glaucoma something that is a standalone condition, or is it something? Or is it related to something else going on in the body?
It can be both. It can be a standalone. It could also be, a manifestation of poor health. It could be a manifestation of genetics. It could be a manifestation of medications that people are taking that can cause the pressure to go up. But whatever the cause is, we need to figure it out and get treatment going because we want to stop as much vision loss as we possibly can.
I mean, have you noticed an uptick in glaucoma cases with the rise in obesity rates?
I've noticed a lot of diabetic stuff happening, more problems diabetic-wise on the retina. Yes, that I've noticed a lot. So logically speaking, yeah, it would have to be an increase in glaucoma as well. Have I noticed that? No, but I haven't really been thinking about it, honestly. But I'm gonna think about that in the near future.
Is that one of the most common conditions you see coming into the hospital?
Glaucoma? Yeah. Absolutely. Again, glaucoma is more prevalent in African Americans, Hispanics, people with vascular disorders like high blood pressure, diabetes, and that's RUMC. So the population at RUMC is basically an advertisement for glaucoma.
And if I remember correctly from your town hall, you said people were more prone to it if your mother had glaucoma, your mother's side of the family?
Yeah, mothers and fathers are both certainly something that you need to really work on. I had no family history, which was kind of interesting. So, even if there is a family history, you should really kind of get it checked anyway. And I'm living proof.
How do you tell someone that they've got glaucoma? Because I think some people may, oh my God, I'm going to go blind now.
Right, and it's a good reason to be a little scared. So first of all, people are usually like, really? Like they pick again, silently for sight, no symptoms. But I usually tell them, based on what I see, that this is definitely controllable, and they're in charge of this, essentially because they need to make sure to put the drops in and all that kind of stuff. And I think patient reassurance is always a good thing, whatever you're telling them to have something that's frightening like glaucoma. But I tell them, if we really take good care of you, you let us take good care of you and you do your part, chances are you can live a long, healthy life and everything is under control and nothing happens. There are cases, of course, that doesn't happen, but for the most part, we can control, what's going on with regular, ordinary, run-of-the-mill glaucoma. But, it's kind of we both have to work together. You have to put your drops in and come in for your follow-up, and I have to do my job and make sure that everything is good.
If somebody does follow the proper, precautions, they can avoid blindness.
Absolutely.
Growth.
That's always our goal. Absolutely. 100%.
Yeah, I think glaucoma for some people kind of falls into that. I've heard of it. I know a little bit about it, but I don't really have it, so I don't really think about it till you get the diagnosis, and now it's like you're reading up and like, wow, and you sit there and you're probably like, wow, I should have gone for those eye exams,
Well, people neglect it, like you say.
Yeah, it's
easy to go 2 years without an eye exam.
If you don't notice any change in your vision.
Yeah, especially during COVID.
Right.
Which we just hopefully are out of.
Yeah, I kind of find like, again, to me, there's always that like kind of trifecta. You go for an annual physical and you go to the dentist. And the eye care side of it, to me, always, when I talk to people, it's like, yeah, I go to the dentist every 6 months. I go for a physical every year. But what time of your eye check? It's that kind of, unless they say to me, well, I was noticing that my vision was a little off and I needed contact lenses. It's not something proactive, I'll say.
Yeah, one of the things that I constantly hear is I didn't get my eyes checked because I go to CVS and I get readers and I'm great. Or I go to the motor vehicles and they check my eyes there.
So I feel like I'm more proactive with my kids' health, vision, things like that. Like I'll take my son to the eye doctor all the time, but I probably haven't gone. I've ordered new contacts, but I probably haven't gone and gotten the test in a couple of years. So it's. But I was telling you earlier too. I was reading the other day about I can't. Like I think bifocals are in my future.
Well, it's kind of like, we're going into the summer months, so they tell you to wear sunglasses, the UV blocking, just for eye care from glaucoma. But in general, and I remember growing up, it was like UV sunglasses. I never heard, what did you need that for? It's like, that was like kind of space age thing.
Yeah, of course. I'd love to get a little personal with you.
Sure.
And find out what interested you in the field of optometry.
The The real story is I took piano lessons when I was a little boy, and then my piano teacher's daughter was beautiful, and she was an optometrist. So that's the real story. The other real reason was I wanted something. I knew I liked eyes. I thought eyes were really, really fascinating, and I still agree that eyes are really fascinating. I didn't want the surgical aspect of things. I didn't want to do that. I'm not into surgery. I'm not really keen on blood. So optometry was perfect for me. So when I kind of discovered it, I was like, the sky's open. Like, this is it. This is what I want to do.
Yeah.
So that's kind of how it was a combination of being in love with my piano teacher's daughter and, really thinking eyes are really cool. Yeah. So that's kind of the real affected my whole life.
Do you still play the piano?
I do. Not well, but I do.
Are you still in touch with the piano teacher's daughter?
Yes, actually. Yeah, no, Harry. She was much older than me. But yeah, she was great. She was really instrumental in me, like, figuring out the pathway to become an optometrist. And I still talk to her, not very often because she lives in California now. But I do talk to her once in a while.
Oh, it's awesome.
Yeah.
She definitely shaped your life.
She definitely shaped my life. Absolutely, 100%. I tell her that now. I wouldn't tell that when I was a kid.
Do you have any hobbies? What do you like to do to decompress?
Yeah, one of the things that I recently discovered was yoga. I had some trouble with my back like the last couple of years, and a good friend of mine is a yoga teacher, and she's been hounding me to kind of just try it. I don't know. I'm tired. I don't want to do this. I'd rather sit on the couch and do nothing. But I tried it, and now I'm hooked.
Yeah.
I really, really enjoy it. My back feels amazing. It's not as easy as it looks. It's really not. I was like, this is, I could do this. And
but you can't stand on your head.
Downward dog.
No downward dog. I do straight dog. Nothing downward. But it really is amazing. So I guess I'm into that. Yeah, that's my new thing. I don't know if in 6 months I'll still be into it, but that's what I'm into right now.
So as a segue from yoga, are there exercises for the eyes that you can do? Or
No, not for glaucoma. No, no. But you should avoid standing on your head and doing all that kind of fun stuff.
And you live in Westchester, right?
I was born and raised in Yonkers, New York. I went to school in Manhattan, but I live now in New Jersey because the commute from Yonkers to Staten Island is just not doable.
Where in Jersey are you?
I'm in Elizabeth right now. So now I'm a 15-minute drive, which is really kind of cool to get to work in the morning. So it definitely beats like an hour and a half, 2 hour, 3 hour commute.
Now, aside from the piano teacher's daughter, who or what inspires you?
I think I'm inspired every day by helping the people that we kind of work with. Changing someone's life by giving them a pair of glasses. Now they can see at work and function in their daily routine. Like we were talking about his son, if I may talk about his son, his son had some eye issues that were just kind of taken care of with glasses. And, so now he's going to do better in school when he's going to be a better athlete. He's going to be, whatever he chooses to do, he's going to be better at because his eyes are working really well. Very often in eye care, we find other things, that are wrong with the person based on what we're seeing in the back of their eye. We often find diabetes, we find high blood pressure, we find HIV, we find a lot of serious things in the eye. So being part of that team that can kind of, work with the person to get them where they need to be, to help them, to essentially live, is really kind of cool. You don't think about it because you do it every day, all day long, but it is kind of cool. And that's kind of inspirational to me to be able to help people. I guess that's why, or at least I would hope that's why most healthcare providers go into, some kind of a healthcare field, because they want to help people. And I think that's really inspirational.
Then you see you see those videos of like kids getting like a hearing aid or glasses, and their face
lights up. Yeah,
it's amazing to see that. Yeah, it's amazing to see that. But that's got to be, when you're dealing with someone who comes in with a condition, and over the course of care, you see the improvements. That's got to be very rewarding.
I was telling a story like that to my dad one time, and my dad has since passed away. But I was telling him a story about a little kid. He can see now he's doing better in school, and now he's doing better at soccer, and his whole life is better just for a pair of glasses. And my father was like, "Yeah, that was my tuition money go into good use." So he was kind of right.
Yeah.
But so that's kind of my.
And you
my
mentioned that
motivation.
you've seen a difference in Finn with the glasses.
Significantly. Not only with school. I mean, he's a bright kid. He's a good student. But I remember when we were first starting to coach him in football, if he got a handoff, he wouldn't know where to go. He was like, he would look around. He wouldn't necessarily know what he was doing. And we're trying to get him like, you got to run, you got to go that way. And then like all of a sudden I'm a terrible parent realizing he couldn't see, you know? And then once we got him the glasses on and stuff, he's excelled. He's done great. So, and it really, getting him in early was important because then we didn't have to go through eye patching and we had to do some eye exercises with him, but it was basic stuff at bedtime. But his vision is great and he's 100%.
And now, given with the experience with Finn, I imagine, are you more up on Ruby, your daughter's eye care?
Yeah, we were worried about Ruby for a little bit because we were ultra cautious, or we were looking for a problem. So we thought that she started getting an eye that was like turning in, or that she had like a lazy eye. But ultimately, we ended up taking her to the pediatric eye doctor, and he said like her eyes are just farther set back, and it's a perception that she has this thing, that she doesn't have a bad prescription or anything. She's actually got decent vision, and it was good that we were like early intervention, trying to get in there and pay attention to it. But it was almost like as a parent, we were looking for like, is there a problem here for it? So it's good to be cautious, but there's not always going to be that problem.
Right.
But she's doing good, and we've kept her, you know, when it's just a thing now. If we take Finn in, we're taking Ruby to her.
Yeah, absolutely.
Yeah, she's 3. It's a different,
Right. But it's like with anything in a family, if someone's diagnosed, if one kid's diagnosed, you become more attentive, you know, to the other.
Absolutely.
So open up the floor to you for our last few minutes together if you want to talk about your colleagues in the ophthalmology department.
Okay, so our chief, like I mentioned before, is Dr. David Mustafavi. Besides being a great guy, he is just one of the best surgeons I've ever worked with in my life. His surgeries are absolutely amazing. He's also a uveitis specialist. Uveitis is an inflammatory disease of the eye, so he deals with a lot of patients with arthritic problems and with eye manifestations. People with rheumatoid, other autoimmune disorders, lupus, things like that. So I've learned so much from him just by being a sidekick, like, you know, in the exam rooms with that kind of stuff. He's a great guy. His surgeries are impeccable. He really does the right thing all the time. You know, that's what I think. I told him, he asked me what I thought of him one time as a surgeon, and I said, I really think you do the right thing all the time. And that's important. You want someone who's going to do the right thing for you and what you think is the best for you. We also have, coming on board shortly, is Dr. Christina Vici Domini. Nice Irish name. And she's just finishing her fellowship in anterior segment, so she's a specialist in the front part of the eye. So she's coming on board, and we're so excited to have her as well, because we've worked with her for the past year during her fellowship, so she's great. We also have Dr. Nina Gadangi. She's a pediatric specialist at our hospital, so she sees only children. She deals with a lot of the problems that, you know, you were describing about your 2, or your 1 rather. And so that's our crew, and myself, I'm the fourth one there. We also have, like I said, residents from SUNY Downstate. So we have 3rd and 4th year, I think it's 3rd and 4th year residents from Downstate who are doing part of their training in ophthalmology with us. So they're always a bright point to our existence there, because they know the latest and the greatest of everything. They're just getting out of school, so you kind of got to listen to them a little bit too when they're talking. And we have students now from the SUNY College of Optometry that are working with us as well. So that's always a great thing to have bright, bushy eyes, and bright and bushy, bright eye and bushy-tailed students. One of those with us. So yeah, it's a great place to work. We all get along really well, which is a great thing. You know, we socialize outside as well as inside the clinic. So.
You know, I think it's a great point, because I think a lot of people wouldn't necessarily think of going to a hospital for an eye care center. They would think of going to their local optometrist or CVS or someplace like that, because to most people, if I'm going to the hospital, I'm going to a hospital because I have an emergency. I'm not going there for preventive care, like just an exam. And to know that you've got a full service eye care, vision and eye care center in the hospital, you kind of have to get away from that stereotype of going to a hospital because you're actually getting better care. But it doesn't necessarily mean you have to go to the hospital, you know?
Well, I think that's a unique part of RUMC too, you know, is that there are different facets of it, and it can be a pleasant experience.
Right.
It's not just a trauma that you're going for.
Right. I mean, we have a number of different departments, and it's kind of that, like I said, it's a stereotype that, you know, I wouldn't think to go to the hospital to get an eye exam. I'm going to go to my local eye care doctor. I'm not going to think to go there. If I'm going to RUMC, it's because either he made me go there because he found something, or I'm thinking something serious is wrong that I need to do a step up. And knowing that you have people who are coming just for their general eye care, you know, that's an important option that people, and we accept, you know, you accept most insurances. It's the same as going to, I'm imagining, a local doctor.
Absolutely. You know, we're starting to see a lot of referrals in from local optometrists and even local ophthalmologists as well as endocrinologists, because they see a lot of diabetics. And eye cares are super important with the diabetic. So in the 4 years, or almost 4 years that I've been there, I've seen a big referral base starting to develop. And that's kind of, you know, I'm kind of happy about that, you know, because we kind of worked hard to build the whole clinic up. And I think if people are happy where they are and they feel well cared for, they come back, bottom line.
So when people call in for appointments, or they go online through RUMC's website to get appointments?
You could do either or. I believe the website you can do either or you can call our clinic directly at 718-818-4848. And the secretary will be more than happy to make an appointment for you.
And on the website, under our services drop-down menu, we have vision and eye care, and there you can meet all of our physicians, all the procedures that they do, and you can also get information on making an appointment. And we would, you know, as we've talked about today and in the previous segment, a couple of minutes of your day to come in and get an eye exam, even if you found out that all you need is glasses, or you're diagnosed with glaucoma, you know, you're in the hands of experts.
Absolutely. So we'd like to thank you for coming in and joining us today. It was a pleasure having you, and thank you for all you do to keep us safe and healthy. That about does it for this episode of RUMC Connections. I'm Meredith Gaskins.